Is Wave's use of AI in coaching really ensuring that specific challenges and unique needs of women are also met?
Women's health is definitely something that's of huge interest to me. It's a lot of our content is even guided by my own experiences. When I started going through perimenopause, I was like, we need to go build out a content library that's dealing with all of the mental health issues, and also encouraging people to assert themselves within the medical system as well. That's something I'm incredibly proud of. So we've built a tremendous content library around women's health issues, stemming from hormonal imbalances and PMDD in teenage girls, all the way up through how to have a healthy sex life post menopause. So we take that incredibly seriously on the content level, and we really want people to understand that issues, especially that not taught and are underrepresented within the medical space and the medical sphere, were touched on in our app. So we know that, I mean, menopause is such a hot topic. Hormonal health in general is such a hot topic in terms of how much are we even talking about with our doctors? Are our doctors even trained for this? And so we really tried very hard to bring all of that content, all of the things that are impacting women into the app, whether it be struggling with infertility, whether it be struggling with your first sexual experiences as a woman and consent and how to say no, whether it be, again, having hot flashes in the middle of your day at work. So across the continuum and the developmental continuum, we've tried to really address those issues. We also think it's fundamentally important to teach our 22-year-old women about menopause early, about that this is a continuum of their own hormonal health and care. So when they're hit 43, like the rest of us, and suddenly are having all these symptoms and don't understand them, that they know and they're prepared. I feel like that it's a travesty that the medical profession has not done better into socializing these issues with us. And I think that it even goes to our doctors, right? We know that women are not believed in their doctor's office, even by female doctors, even by other women. And so one of the things that we really try to impart is and empower is how to advocate for yourself in medical settings, how to know if you're being medically gaslit or if someone isn't listening to you. So we actually even have practices around what to say when your doctor isn't listening to you about your symptoms, and what to do and when to kind of cut bait and go to another provider versus understanding when to stay. Assertive communication and self-advocacy is a huge part of what we try to teach the women in our app, our users.
That is so interesting because that is really a great way for women to be able to take hold of their own care journey, being a self advocate, speaking up for themselves.